I just go run with that one, however it best makes sense to you. What, 30 seconds?
I only get fired.
Wait, are you ready? We haven't started yet. 30 seconds, ready, and go. Remember, no talking in Campbell's Pepper. You guys can start guessing.
Fever?
Tibia.
Which one is it?
Looks like a tibia. Who's talking to me? That's a
What the
tibia.
hell? Is that a hot dog?
That's a
It looks like Forky. Forky.
Fibia. Fibia and Tibia.
Fibula.
Fibula.
All right, that was easy.
So why
Okay.
would you make both? I don't get it.
So you could see what kind of bone it was. All right, so Gabby, you got it. We'll make them harder as we go along. I want you. We're gonna have them guess this right here. Still puppy. We need this term to be guessed. Okay. Go. It's not that hard. Ready and go. We need that specific term.
It looks like a donut. Oh, femur.
No.
No talking. No talking. 15 seconds.
Meniscus? Yeah, so I was gonna say.
No letters.
Why not?
And that wasn't even helpful.
Right.
What? Tibia?
5 seconds. Wait, before anybody guesses.
What was the word again?
Hold on.
Oh my god.
0. Wait, don't say it out loud. Let me see if I can get them to guess it. Hold on. Hold on. So nobody guessed it off of this. Okay, hold on. Let's see if we can get
My round was bomb.
It was not bomb. It was terrible.
You
we
lost
lost
talking.
I just start the timer. I don't need to start the timer because they're gonna get it. Look at how confident I am. Okay, you ready?
Yeah.
Okay, no, no, you-
What did I say? Meniscus? Oh, tibial plateau.
Dude, why don't this is my plate, and then the two.
Tibial plateau. I don't know what the
tibial
two.
plate two. You get it? You guys freaking haters.
Did you say you suck? Okay. So, anyways, all right. So that was tibial plateau. Why is that important? What is on our tibial plateau?
The femur.
More specifically, what is right on top of our tibial plateau?
Oh, the meniscus.
Meniscus. All right.
Well, isn't it the articular cartilage and then the meniscus?
Susu, come on over. Let's do my girlfriend. Come over here.
Sorry.
Ooh, let's maybe this. Get this term. We want that term.
Okay.
Can we do that? Is 30 seconds long enough, or should I do 45?
45. It's not, because we don't have time.
Oh wait.
to think
All right.
Ready?
Ready? 45 seconds. And go.
Teardrop?
Nose.
Nah.
Ooh, a teardrop.
Say,
Is that patella?
So if
That's
they're
the
if they're
fluid?
right, you can like mark on there and make. I caught it. We're
That
good.
is
That was fast.
It does not.
Why? You said it was quad. I don't know.
Oh, I know what this is. I know what this is. No.
It's
The fluid, the juice fluid.
The juice fluid, she says.
What?
That's it.
Cartilage?
Do you want me to try?
Yes.
I don't know how I don't even. All right.
No.
All right. Let's see if I can try and then. Okay, use purple. All right. You know what it is. All right.
Femur?
Booty.
No, femur. Conda? Oh, that is not a little.
Oh, it's like the stuff in the It's the
A tendon? Patella.
Patella.
Hey, gets me. Patellofemoral joint. So
Yeah,
what's
I
in our
was supposed to get
patellofemoral
that
joint?
from
She was getting it. So the patella and the femur articulate to make the
Okay, I'll just
patellofemoral joint, right?
What was the other one you were saying? That. And what's that between? Okay. Oh God, that's awful. That's not my good.
Dude,
These are not like these are not. Okay. All right. Okay.
What's next?
Yeah, this is true.
All right, Peyton.
No.
Let's see. Come on over. Come on over. Come on over.
hey, can you like? No.
All right. Let's do.
And I could study.
My neighbor was texting my mom asking if everything was okay because I hit my head so hard. They heard it in their house.
All right. This should. I feel like this should be an easy one.
You guys listen. I swear my sheets
Let's
don't
go
fit my
with
bed. Like,
this. We want this
I'll put
term.
them on one side,
but
like,
we
rotate,
want-
and then flip it inside out, like you do it again. I'll sit there for like
Specifically.
I'll sit there for
them
like
to
2 hours
say.
trying to do it. Every single time I get that last one, I'll flip it the other way. You gotta be
Okay. So we want them to say medial
I even tried
and then that'll be
stretching
what
out.
we're looking for. All right.
That's not frustrating.
All right.
And my mom keeps
On your mark.
like, trying to be serious,
Go.
and she got it wrong first.
When you're covering it.
Why is it drawing the tibias like that? I'm so weak.
Because it seems easy in your head, and then you go to draw, and you're like, oh, woof.
Patella. Femur. Oh, I know this. That's one of the muscles.
Ooh.
This is one of the muscles. This is one of the muscles in the back. Lateral. No, medial.
Is that the meniscus?
I don't know what that's supposed to mean. What
We're
is
so
that?
close.
The femur.
Am I right?
We have no.
So it's a muscle.
Ignore Gabby. Keep
Is it
going.
the medial ligament. No. Dang.
Hold on.
Oh, it's medial.
Medial what?
What is it called?
MCL.
MCL. That's not a ligament.
Medial meniscus. Oh.
That's what it's called. I think
I think you
play
get a
this game.
better drawing.
Okay.
Okay, I can't draw.
I can't either. What does our meniscus do?
It's a shock. It's a pillow.
Uh huh. And we only have one?
2.
Oh, technically we have
4.
4. Ah, get out of my head. Okay. Uh-huh. Okay.
And what shape are they? C.
The crescent. Yep. What kind of surgery can they do if there is an injury to the meniscus? Arthroscopic surgery. Right. And what do they do during that?
They shave it or they stitch it up.
All right. And if it's really, really bad, what can they do?
Take it out.
Perfect. And what is it? What is it made out of? So why is the meniscus? Who said it again?
Soft tissue.
Tissues. Yes. Tissue. I hardly even know you. It is a type of what? Your meniscus is a type of
Tissue. Cartilage.
cartilage. What type of cartilage is it? Because in the knee we have 2 types.
We have articular cartilage, and we have.
This one.
This one.
Meniscus.
Do you want to rhymes with?
Yeah.
Rhymes with ribro cartilage. Fibro cartilage. You guys are so
I
good.
just read that.
Okay. Tara? Come on up. You're the first one down on. What are we playing picturing? We did that one. Let's go. Ooh, we want this term. Or somewhere. Okay, so if it's one of those or whatever, we want this
I
term.
might
How about we draw that?
Tara, I'm not the artist here. Don't come at me.
I had to draw all that.
Yeah. I don't know. However it takes for you to get your point across.
Oh,
Oh, miss.
that's the top, right? Okay, that's not the bottom. Now let me draw that. Okay.
All right. Are you ready? I have so much faith in Tara. I have so much faith. Look at me. Totally. Yep.
Wait, I got
What? Okay.
Okay. Oh no.
Ready? Drop.
Okay, that's the femur.
Wait. This is one here.
Oh, that's the tibia.
Oh, those are your four adductors. Your four muscles. Quads.
No, that's the hamstring.
What's your final answer?
The quads. The quads.
Quads. It is quads. Yes, it is quads.
She needs to draw another one.
She did.
I did. Quads. I added right here.
She added one. So what are our quadricep muscles?
They are the rectus femoris.
What's medial? What's most medial?
Medial.
Vastus
Medialis.
medialis. What's lateral?
Lateralis.
And what's in the middle?
Intermedialis.
So what are the four muscle groups? Start with a R. Go medial.
Vias vastus medialis, lateralis, intermedialis.
All right. And where are they located? Anterior thigh. And what action do they perform at the knee? Knee extension. Okay. Just helping a little bit. Maybe not the pictures, but it's leading us to questions.
My turn.
Yeah? Yeah? I would color them both since we have two.
Oh, I didn't see that.
Do I look so plain?
Okay.
It's not even funny.
Your name?
I said I look so clean. I have nothing on my face.
I'll scream it right now.
No eyelashes.
Oh, that's rough. Alright, we have a guest coming. Alright, not today. Not today. Okay. Let's go. Is there anything that you see too that you want to do?
Let's go.
Let's go back up. You want something here? Okay. Oh, they all are good. Appreciate some money.
I just guessed it. Like,
All right.
I didn't even need it.
Here we go.
Okay.
Here we go, Kimberly. Here we go. Here we go.
Ready?
Yes.
One,
Go.
Femur. Okay. Ligaments.
Yeah.
PCL, ACL.
You're just blowing things out.
PCL. No, the
ACL.
no, the ACL's in the front. The
And that's the
LCL? No. ACL. MCL. No, LCL. That's lateral. That's
Holy
lateral.
Lord, somebody give me a final answer.
LCL.
Oh.
Yeah.
All right, so let's talk about.
Look at me.
First of all,
You yelled out every single one. Look at me, she
I
said.
said ligaments.
Biceps tendon.
These muscles are right there.
Look at me. I listed everything in the body and I got it.
I said MCL or LCL.
I still got the ligament part.
You did. I'm so proud of you. I'm so proud of you. I got it. Okay, so we have 4 ligaments that we've talked about in our knee. What are the 2 groups?
The cruciate and
Cruciates and collaterals. Kimberly just drew one of the collaterals. What's the other one?
the MCL.
Which stands for?
Medial.
Lateral ligament.
All right. And they resist what? What forces do they resist in general?
Blow. It's a blow from either side, like.
Yeah, so it's trauma or force. So they help with keeping stability at the knee tear when it's bent. So yes, but specifically their job, based on, I don't see the picture. Oh, it's got a beautiful picture. So it resists a force. So if coming either like medially or laterally to the joint, the respective kind of opposite ligament is going to resist that trauma or that blow. Okay? So the lateral collateral ligament resists what?
Medial blow.
A blow from the medial side. Okay?
And then you have
And-
PCL and PCL and ACL. That's your cruciate.
Cruciates, exactly. Where in general is the LCL located? Like, what are its attachment points?
The anterior part of the femur to the posterior part of the.
So it's not, so don't say anterior. Your LCL, not really anterior, because that's going to be in front, right? So it's more lateral. So you're probably thinking more like inferior. So it's inferior lateral femur to what on the tibia? Sorry, lateral fibula. Sorry. Edit that. Because we're talking about the lateral collateral ligament. So it's on the lateral side. So superiorly, it attaches to the lateral portion of the femur, right? Lateral inferior femur goes to what?
Lateral.
Not it's fibula, because it's lateral, and your fibula is lateral. Okay, so I started to say something else, like we were on the lateral side. So it's going. If you have a picture, this is my femur, this is my tibia over here. My fibula is this way. It's gonna go from the inferior portion of my femur, and it's coming down this way and attaching to the lateral side of my fibula, which is lateral.
Do we have to specify like superior and inferior?
I'm not videoing. She is videoing.
I'm going on a trip and I
So if I ask what is the location of the LCL, and you just tell me femur to fibula, maybe in your brain you think it goes, and I'm not saying that it does, but maybe in your brain you think that it goes from the femoral head to the lateral epicondyle, which is, or lateral malleolus, either or, right? So give me a general description so that I know that you know generally where it is, okay? Let's go.
It's me. Sorry, I was nice.
Ooh, this will be good. You're gonna love this one. Love you, mean it. Do that. No, she's whining.
Okay, great.
Oh, she's ready?
I have 45 seconds.
Do you need more? All right, give me a minute.
No, you don't.
Give me a minute. That's a lot.
She might.
Oh.
We're going for.
She might.
She might. Love you, mean it. Ready, go.
All right. And then I'm sorry, y'all. She be wanting to give me some hard stuff.
Guys, I love y'all. I'll be here. Likely, literally right here. Mhm.
Is that the rice?
It's
That was in 30.
I love you.
That was less than 30 seconds. What did you draw? Let me see that. Oh, it's actually. You don't gotta throw things just because you're angry.
Sorry.
That's actually a pretty good indication. You know something's not right when you're drawing dots and X's and O's. Good job. All right. So what is arthritis?
A disease that you get when your bones rub together.
When the cartilage starts to wear out.
There's a breakdown in what type of cartilage? Articular cartilage. And what does that cover?
The tibial plateau.
Tibial plateau. It's underneath the meniscus. And what else?
Bones. Where your bones stand? I don't. The end of the bones.
So think about we say articular cartilage. It covers it. There you go. It covers the ends of the articulating bones, right?
I was right.
So you were right.
I was almost there.
So it's going to cover the tibia and then what on the femur? Think about it. You can see the shiny blue on the slides that we've shown up. It covers what? The condyles, right? So it's that shiny blue, almost looks like metal on the PowerPoints that we've seen it. It's a shiny, slippery surface to reduce the friction between the knee. Well, in the knee joint. Okay? So that's your articular cartilage. That wasn't hard, so you got it. This one over here. All right, let's go. Who's Tara? Are you next? Is your turn? Or Peyton? Sue? Somebody. Anybody. Anything of interest to you that you would like to draw? Or are we just picking?
Oh, Susu gets to pick, but I just had to have that.
Yeah, exactly.
Ugh.
Keep it up. Okay. Let's go.
do you mean? Why do you have backup?
I'm reading that.
I know.
Ooh,
You can live with
how about this?
Yeah, wait. What is this?
Okay. Got it? I don't think you need a minute. I'll drop it to 45. Is that okay? Oh, she's going. She's going. She's going. Here we go.
Guys.
She's on a mission.
There's a hole. I'm guessing.
She says there's a hole. I'm guessing.
Surgical patella.
All right, just
That,
keep
like,
going,
reminds
keep
me of
going.
waking up and I get
Right,
like
me
an attack
too.
every
Is that what you all wake up to?
Yes.
Oh, I wake up to like.
I don't wake up.
I do.
I wouldn't wake up.
I
to
would
that.
literally wet my bed every morning if that's what I woke up to. Like that.
That every
So
time
don't
it
judge.
goes- Every time
I've
it
had
goes off, I
babies.
feel like I'm waking up and I feel like I get an attack like I'm late.
Damaris.
Okay, go ahead. What is that? What is it?
What is
Oh,
that?
I can tell them?
No.
Is that
Wait,
bad?
No. Don't tell. It's not bad. No, it's not bad at all. All right. Why don't you give them some verbal cueing as to what that is? Like, what does this do?
Well, we have about 14 of them.
Oh, good. Come on, Peyton.
14 of them?
Yeah, and it's inflamed.
Or tendon?
14 of them specifically around the knee.
Bursitis?
So, bursitis is an inflammation of the
Isn't it like
Tendons?
tissue?
the bursa.
Oh,
What?
So bursitis, the itis, is an inflammation of the bursa, which is what? What is a bursa?
isn't it like a yeah?
It sure is, Peyton. It is a fluid-filled sac. I like the way I know the way she said. Isn't it like it actually is that exactly?
I was thinking of saying it, but I was like, what? That's what?
So
That makes-
Sue was drawing specifically the sac behind the patella. That's kind of like the big one that was on the slide that it showed because there's 14 of them right around the knee. And I remember I was like, I didn't even realize there was that many. So they are a fluid-filled sac. What is their purpose? Ooh, questions.
Cushion.
Cushion to prevent what?
Friction.
Friction. Reduce friction. It supports. What happens when they become inflamed? We have bursitis. Okay.
That was
And what's in them? What's in the sac? What is it filled with? What kind? Synovial fluid.
Dude, you're on a roll today.
Keep that there for tomorrow. Keep it. Okay. Peyton, is it your turn?
Yeah.
Ooh, let's go here. We want. Oh wait, no, not this one. We want that one.
No, you're fluid. Oh, my back is killing me.
We better keep it away from me.
No.
Wait.
So dumb.
Oh.
Yeah, I don't get it.
No.
You said your back is
Alright, do we wanna
keep it away
do
from me so it doesn't kill
This
me.
one. Well, these are more at the other.
They're more like the.
Do you want to just do this one?
Yeah.
Okay, go ahead. I'll give Gabby a harder one. Was that out loud? Actually, you laughed at my joke, so. Wait, did I tell you my toilet joke?
Yeah.
Ugh.
Upon plenty.
Like, yeah, 3 times.
Okay, guys, you know what? Do you want me to tell it again?
No.
Then you have it on video. What did the one toilet say to the other toilet? You look flushed.
Yeah, I got you.
Thank you. See, Kimberly didn't hear it. That's why I had to tell it again. Damaris liked it. Her face tells it all. It just. All right, sorry, Peyton. Let's focus on Peyton. Okay, here we go. Ready? Oh wait, I'm not ready. Who brought her?
Hey, you better be graphic, man.
Go, go. Oh wait, I started. Go, go. You can't take me back.
Femur.
There we go.
Don't tell me to check my rings watch.
Okay, the quads.
Oh, hey. Hamstrings. How many hamstrings do we have?
3.
Uh,
3.
We have 3? Okay, Gavin. We have 3. 2? How many hamstrings do we have?
3.
3. Wait. What are the name of our hamstrings? This is going back to the other one, the other PowerPoint.
Membranosus and semi.
But
It starts with a B.
it sure does.
Biceps femoris.
Biceps femoris, says Kimberly. She came out. Did you see her? Yeah. Right. I get excited about my biceps femoris. Okay. Can you stop videoing? So terrible. I keep forgetting.
I love it, yo.
I keep
I'm
forgetting.
gonna be a maniac
I
on the
hate
plane
it.
just laughing.
Okay, I hate everything about this. All right, so our hamstrings are located where on our thigh? Posterior. Okay, and what do they perform? What action do they perform at the knee?
Flexion.
Flexion. What do they do at the hip? Out of curiosity. Extend. Perfect. What else about the hamstrings? I think that's good. I think we'll move on from the hamstrings. Who is next?
Tara.
Come on over. All right, I'm gonna give you. Are you good with this one?
No.
What?
Hey, let me see that picture.
Okay.
Okay. No.
Yeah, come on, girl, you got this.
Wait, that's
You got
the.
it.
No. Oh, that's the part.
Yeah. You can do it. I have so much faith in you. All the faith in the world. Just a portion of it.
Wait.
Okay. See, that's what I started with. Wait, why am I showing you my phone? I'm gonna cancel 30 seconds.
Yeah. We're back to 30.
Are you? Yeah, it just kind of happened. You guys were warmed up. You got Peyton. She's nailing it out of the park. Stretch, and go. I even gave you an extra second there. You're welcome.
Nerves? What is that?
Stop.
Brain. Central nervous system. Gas station. Car.
Is that the way?
Bed. Puerto Rico. Hey!
Okay, that's the femur. Oh.
We're gonna just ignore this.
Biceps femoris.
Is that the
I
guy?
know it.
Who's that gastrocnemius? Why I didn't understand you when you say it nicely. I need like gastrocnemius.
Dude, oh my god, I knew that.
Okay.
I'm so glad I knew
So what?
No, I low-key like how that was the back of the foot and the toe was over here.
I think she was trying to give you perspective.
Yeah.
So what? Woo, our gastrocnemius. Which two joints does it cross?
It's mad long. It's
Is that the ankle?
The jankle and the. It crosses the jankle and
In the foot.
in the G. The jankle and the G. Yes. The gastrocnemius crosses the ankle and the knee.
so
Because
it's like
you
up
need to
here,
pop.
right?
Yes.
I do that. See if that works. Get it out. Like,
It's up here, right? And then it goes all the way like down here.
So where does it generally originate from? Which area? Which bone does it originate on?
The femur.
The femur, on the condyles, okay? And it inserts where?
The calcaneus
The calcaneus, which is nice.
of the foot.
Yes, and what's our calcaneus known as?
Your heel.
Our heel. So this back here, you can grab your Achilles tendon. It's pretty gross. You can squeeze right in the back of your ankle. And for that thick tendinous band, that's your Achilles tendon, which is not just your gastroc, but what is deep to your gastroc? Which muscle? Soleus. She's in. So your gastroc and your soleus form that thick tendinous band. That's your Achilles tendon. Okay?
Yeah.
What does your gastroc do?
Okay.
At the knee. Sorry, at the knee. Knee flexion. What does it do at the ankle?
Extend. No, flex.
Flexion. Okay? So when we talk about flexion, is it dorsi or plantar? Have you learned about this yet?
No.
A little bit we did with motions when we were going through the planes. So dorsiflexion is coming up towards your shin. Plantar is when you're pushing down or you're planting your foot. Okay? So your gastrocnemius is a muscle that's purely posterior. So it's going to bend the knee into flexion. And what's it going to do here? Hold down into plantar flexion. Okay? All right. You want this guy?
Okay.
Okay. Okay. Oh. Yeah, I was. Oh, who, me? Yeah. Cancel and start. Sorry.
I'm tired of drawing freaking femur. Calm down. So that's this is the fibula. What the? Oh, I know this.
It's pec-
oh, I know
something.
this.
Pectus.
Pectineus?
Not pectineus. Keep going. Keep ignore the timer.
I know
know
this
it.
one.
It's like a giant, huh?
It's like a drawing.
No, it's
No, it's
She's
not
like, it's a good
very
drawing, right?
I do. I remember this one.
Yeah. It's like PE, something like that. No, not
No, not perform.
PA.
I don't know.
When I stick a needle into a balloon, what does it do?
Pop.
Okay.
Poptinius?
No.
Dude, I know this one. No, it's not pop.
It's pop. And then that party was.
Pop Liddy? Yo, get a life.
That's so cool.
She said that party was.
Okay.
Videos.
Okay.
I know it was ears, so I had to. That's not like Tinius?
Popliteus. Okay. So your popliteus is this little kind of crazy muscle that its main job is to unlock that knee. Okay, which sounds weird, but it unlocks the knee and it allows that teeny tiny bit of rotation. So although our knee is what kind of joint? We're talking about types of joints. Our knee is a hinge joint. So typically with a hinge joint, would we see rotation?
You could see some, but it's not a lot.
You typically you're not going to see rotation at that joint because of the way that the joint is created. It's a hinge like a door frame. Are you going to see rotation? Is the door going to rotate anterior or posteriorly at its door hinge? No, that'd be very weird. It'd be like Harry Potter or something. Or you'd be tripping. I don't know. It would just be weird. So it should not. So you have the popliteus that unlocks and allows for a little bit of rotation at that knee. What is the other thing that allows for rotation? Specifically, that because these things are loosened or lax, we have the ability to rotate at the knee. What are the two structures? The collateral ligaments, because when your knee is in which position, they are loose.
Extension.
They're loose in
Oh
extension.
no, it's deflection.
They're loose, and remember there's a little picture with them kind of all
like this and
squiggly.
they're just like out.
So because they're loose, are they giving as much stability to the knee medial laterally? No. So what happens is that allows for that tibia to rotate a little bit. Okay? And it's your popliteus that they state it unlocks. I don't 100% understand how. I think it's because of its like the torsion that it has when it starts from one side of the knee, the lateral side, and wraps around medially. As that muscle contracts, it allows for the movement. There's fuzz.
What the fuzz?
Fork. I can't watch that show anymore.
Why?
I'm like, I needed a break
You're
from it.
talking about the good.
Yeah.
What is it? The good.
I like it, but I'm at the point where they keep repeating. Like now they're on the side. They're on his side. What the heck is his name?
The black guy?
No, not Chidi.
Is she in,
The main dude, old dude, the mean guy,
the hell guy or?
Oh, the white guy?
the white guy
Uh-huh.
with the salt and pepper hair.
Mm-hmm.
They're now joining his side to help him because he keeps failing, and he's on like experiment like 800 and whatever.
You need to keep watching it.
I know, but I'm a little bit bored in this. I have to come back to it.
If
Okay.
it's like, it'll end like, what the fudge?
Fuck.
What fork?
All right, who's next?
Me. Sorry.
Yeah.
Let's find a nice hard one here. Sorry. Funny. Oh, I know what we need to do. We haven't done these yet. Not that one. Oh, here, but it's underneath this. Let's do this guy.
Yeah, you keep. There's another picture that covers the.
I know it's that it's because it's animated, right? So when you play the slide, you can click through it. I have it animated, like this little thing here, because it moves.
Yeah, you do.
This one. Oh. Oh, wait.
Wait, can you see?
Yes, you may. I love it. Of course you can. You always can, Courtney. All the flashcards in the world. Just like Control Z.
I need to see this.
What are you doing to my PowerPoint slide?
I'm putting
30 seconds.
30 seconds. 45.
I don't even know why it matters because even when it stops, we keep going. So why am I even timing it? Okay, 30 seconds strict.
Fudge.
If you don't get it, we'll
Where's the
just
thing
keep
at?
going. What are you doing? Start. Snakes. Arthroscopic surgery instruments.
The ligaments.
Ligaments.
The collateral ligament.
Yes. Period. Nobody can do it faster than me.
All right. Oh, Lord. I bet you if I drew it now, I could do it faster because you guys would know.
It was the ACL.
All right. Cruciate ligaments. How many do we have?
2.
Technically?
Oh, 4. See? That's why I was like this.
Okay. They prevent, in general, the cruciate ligaments prevent what?
Translation, like between.
The knee moving out of place.
So that's it. So yeah, so translation of what on what? My hip,
The femur.
the femur and the tibia, or oftentimes we talk about it, the tibia translating on the femur, okay? So specifically this one was the
ACL.
anterior cruciate ligament. Where does it attach? Whoa. Anterior tibia.
So, and it goes to the no, and then we did this.
What? Posterior.
Posterior.
Mm-mm.
So anterior cruciate ligament goes anterior tibia. I heard that. That is correct. To posterior femur.
Why
You
was
said
I
fibula.
thinking about that? And then the PCL goes.
Because that might be next.
It might be. Kara's like, don't give it away. she just you'd. Or mead you. She just mead you.
Okay.
Okay. So let's do it again. Our anterior cruciate ligament is one of our 2 cruciate ligaments. We have 4 total, 2 on each side. It works to prevent the translation of the tibia on the femur. Okay? Our anterior cruciate ligament specifically is anterior what? Anterior
Tibia and posterior femur.
posterior femur. Okay? And it prevents the tibia from translating anteriorly on the femur.
Forward.
Oh, I'm like, what?
I'm gonna be like, what does this mean?
Do we have questions on that? Are we okay right now? Okay. Okay. Who's next? We'll do a couple more and then
Oh no, you're not.
Susu? Any preference? You okay? Your neck hurting you?
Huh?
Is your neck hurting
My,
you?
no, the muscle.
Is it like spazzing?
No, it always hurts.
And you
They're
did you
always
work a
like
lot this
hard.
weekend? Like work on just now. What if we do something like this? Is that too easy? Or
Oh, I want to do that one.
this one?
Yeah.
The thing that's yellow?
Yeah.
Okay, I like it. That was me cheering. Oh, she's going. She got me.
Oh, I know this. This is the look, guys. It has a little piquito.
A little poquito.
Piquito.
So similar to, why am I talking?
No, it's not epicondyle. Epicondyle is on the round. That's
The
that is the style. It turns right.
Is she?
It starts with the S. No.
That's your ankle.
No, it's not.
So you guys, she drew it very accurately. Your brains are getting there, but we're not quite there. So what I was going to say was, Tara said it's like the styloid process, and it is, but that's at the wrist. We're talking down at the ankle. So in the ankle, these are known as what? She's what? You're closer with the ma. Malleolus.
I thought she said myeloid process. I was like,
She was, but it was closer than malleolus. So malleoli for 2 malleolus. So which one is this one?
Medial.
Medial. How do you know?
Because it's not the wrong part right there.
But how can you tell if it's medial versus lateral?
where it's at, where the little piquitos at.
There's little piquitos, but why? How can you tell it's? How can you tell
On the
it's?
other side, it would have been lateral because it's outwards.
But how come that just couldn't be the lateral side?
I don't know.
draw another one, but I don't know.
There's a very, very specific reason we can tell that this is medial.
Oh, because there's only one in the medial side.
True. So how do we know that one's medial?
Because there's no.
Because it's on the.
Medial, lateral, femur, fibula. No, little. Tibia, no, little.
You guys work it out amongst yourselves, cause. Tibia, femur, bicep tendon. No fibula, no femur. French fries.
Alright,
Okay,
fibula.
so that's the tibia, right?
no.
That's the tibia.
Yeah, it's tibia.
What is that? The tibia?
I mean,
This
the
is fun.
tibia is literally on the medial side. The fibula is on the lateral side. So how does that make sense? So that's the medial.
Alright.
Tibia.
You guys are going crazy. Do we have a final answer?
Tibia.
Yes.
And its final answer is we know it's medial. Why? Because tibia. Because tibia. Can that just? Is that my catchphrase? How are you today, tibia? So our tibia is medial or lateral?
Medial.
Medial. So if that's on the tibia, it has to be medial. That was so easy.
You guys make my video so long.
Oh yes, we do. Yes, it's us. Totally us. If it was on the fibula, which is lateral, it would be which malleoli? Lateral. Yes.
Go for it.
When I go on the PowerPoint thing for the warm-up, it says there was a problem thinking.
Oh, that sucks. Yeah. I don't know what to tell you. So it's not opening at all. Is it opening on anybody's? Because it was this morning.
What's wrong?
It's still the one.
You can go use use my computer, but I think it's wrong.
Aaron, try if you go to our board, go to classroom on our board because the board is a teacher.
You're laying on the floor.
I feel as if she is, yes. See if it pops up in the feed on classroom on the board. I don't know why it wouldn't do it there, but see if it pops up on the board. So if you open a Google slide, nope, not slide, tab. Okay, thank you. All right, let's do one more round. Ooh. All right. Any preference in your mind what you would like?
Something easy for me to draw.
So something really challenging. Okay, we haven't. that's what I heard. We haven't had this yet. We had this, not this. Okay. Woo, 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 woo. I feel like I sound like a monkey.
You look at the camera, it's not even on you.
Thank God.
I was
You should have just put it like right
Nope,
I
never.
was going
Should-
to, but it's too far, and I know that she was gonna talk.
What?
I needed to
Me?
be close.
Okay, ready? She's going.
Femur. That's the femur head.
You're the femur head.
Bicep femoris. No, I'm just kidding. You didn't get it.
I was not listening. Tell me you're really
That's
great.
PCL.
Oh, oh.
I was right. I said that.
MCL.
I
So
said
let's talk MCL.
It's MCL.
Oh, it's the
Nah.
You tell her, Kimberly. Get her. Get her.
Because remember, M and L is out.
Startled me. Felt like I had to wake up. Okay, so the medial collateral ligament is one of 2 collateral ligaments, technically 4. Right? What does it resist?
Yeah, a blow from
If you get a
The
blow.
lateral side. Okay, it resists trauma or forces from the lateral side. Now we talked about this. What is specific about the collateral ligaments that because of the way that they are created, they allow for something at the knee?
Is it a little rotation?
They allow for a little bit of rotation because in flexion, remember in the picture they're squiggly, they're loose. Okay? And what muscle unlocks that knee to allow for the rotation?
The pop.
Popliteus. Okay. What is something that is still confusing to you guys? Anything that
I just left it on the board.
it popped up? Okay. How'd you do? Oh, we didn't do. Miss. I knew she was that. So. Anyway, I'll give you information.
No.
Behind it.
Okay.
All right. All right, party people.
Where did you start it?
No. I can't find my timer.
Hurry up, it's in your test.
Okay. What did you say? What's in my test?
It's in your test.
Oh.
Well, tooth.
Yes, that is definitely relevant to the knee. When somebody bites you.
The disease that you and Andrea did.
ACL.
Go back.
Ligament.
Wait, no, those are the. Yeah.
Tara, is she right?
That's the PCL.
Yes. Woo!
And it's nothing
I gotta cool off right here. It's so hot. Okay. Let's talk PCL.
Posterior cruciate ligament.
What do our cruciate ligaments do?
Prevent from it going to
a translation of the tibia.
Resist translation of the tibia on the femur. Specifically, my posterior cruciate ligament does what? What does the...
It prevents it from going to the back.
So, talk to me in anatomical terms. It makes me so excited.
No.
One! The posterior cruciate ligament resists
The tibia from
moving
shifting backwards.
backwards, also known as posteriorly. So the posterior cruciate ligament resists the tibia from moving posteriorly or translating posteriorly on the femur. Where is it attached?
Yeah. Posterior tibia. Oh.
Posterior tibia.
And it goes to the anterior femur. Ooh, I
Alright.
like that because they're backwards.
So if you remember one, you flip it, you got the other. Okay?
Yeah. Who's next? Oh, you. Oh.
We could do one more or two. So don't forget, I don't have slides. I guess I put out a couple slides. I don't have slides of your 3 diseases or disorder surgeries. You guys had total knee replacement, ACL repair, meniscus tear, right?
Yeah.
I had the video, the PM.
Say it again. We did. We watched the total knee replacement video in the PM.
What did they say?
They were kind of grossed out. And I actually pulled up both of the other groups. I pulled up your little, the shorter videos that were like really clear and concise because they didn't have those either. And I think those, it was like Healthline or something. Those were really good. I left those up and we watched those too. Some people were grossed out. Some were like grossed out but intrigued, and then others had to leave the room. I was like, wait till it gets to the hammering part. Okay, so I want to say that make sure you're aware of generally what happens with those types of injuries or surgeries. So, and this is for you.
Yeah, that's what I said. And she was like,
Like a part.
like, well, I work.
Can you draw something to indicate that? Yeah. Like what they do. What they do. Like, you know what I mean? Yeah. Okay.
No, that ain't gonna work. Just move forward.
All right, she's ready.
Okay, ready?
Ugh, yeah. Let me set the timer. That doesn't matter. Okay, go. What is that?
Susu.
Dead.
When you're cracking
Wait,
your back.
who just said something? Peyton just said total knee replacement. Let me see what you have.
Is that what it is?
I can't. What did she say? I don't want it.
Oh my god. Oh, freaking, I'm gonna.
Yeah, I don't want it.
Here's a smaller one.
Save it.
Total knee replacement.
Thank you. I will eat it later, I promise. How in God's name did she get total knee replacement from that? Oh, because the knee is bent. He's on the surgery. All right. Okay. Cam, that was actually really good. I like that. He looks a little sick. And the surgeon looks a little too happy. You should have wrote like bang. Okay. So if I put that picture on the test and I have a multiple choice, what is happening? All right. So, what'd you say? Go get it?
It was actually yours.
Oh, you'll get it. So what is happening in a total knee replacement? Why does somebody have to have a total knee replacement? Arthritis of the what? The cartilage. Could there also be meniscus damage? Well, likely, right? Because if that meniscus was intact, even if the articular cartilage on the femur was worn down, there's still the support. Okay? So what do they do? That.
And what do they do in this?
What do they do?
They put metal ones
They
and plastic patella.
they take all the.
Yeah, that's so gross. I'm like picturing it in my head.
But that's good that you can picture it. So specifically, they're doing what? Kimberly, go ahead. You were saying.
They're removing like the wasted.
The disease part.
Yeah.
Perfect.
They're trimming that down, and then they're.
And which bone?
The femur.
And
the
Tibia.
what about, do they do anything to the patella?
No.
they make it plastic.
Sometimes they'll shave the back
The
of
back.
it and they'll put plastic there so that it moves nicely over the new components. Okay, so they're shaving off, getting rid of the diseased inferior portion of the femur and superior portion of the tibia. All right, and then they put in what, Gabby? You were saying they put in.
A patella, plastic patella.
But what are they putting in when they shave down those parts? They shave them down and then what?
Metal.
They put in new metal components, right? Does the person still have a lot of pain afterwards initially?
Yes.
Yeah.
Initially.
Do we know why now after watching the video?
Yeah.
Yeah. So number one, they're just in this prolonged position for 2 hours, right? 2.5 hours, something like that. And then they're like cranking it all over the place. The skin, the muscles, everything's just like kind of pulled off to the side, pain on it. Right. All right. Awesome. So good. I wrote a question to Canberra that said, "Can you draw a total knee replacement surgery?" She did.
That's it?
Done? So then you guys had meniscus tear.
I had meniscus tear.
And you guys are comfortable with, well, you told me what happens. It's arthroscopic surgery. If there's a tear, they'll either kind of shave it off or they'll suture it. If it's really bad, they'll remove it.
always take out the tear, like always.
They get rid of it, whether it's suturing, trimming. Okay. And then we had ACL. So let's talk about that real quick, surgery-wise, and then we'll be done. So in an ACL tear, what happens? Why do they?
They do an arthroscopic surgery, but they could use like
The tendons.
They use like their own tendons or a cadaver's tendons. to
Right.
fix that.
Right? Or an animal, pig, bovine.
Then they attach it to where the ACL was placed.
How do they do that?
they make a hole in there and they put it in, and then they put screws in, and then when it heals, the bone grows in.
It grows over those holes, covers it in, and then that tendon is attached within the knee. It's pretty cool, right? Because here they suture it down. You're like, how do they suture it? And that's essentially how they do it. What often is injured along with the ACL? I think we talked about this briefly.
Wait, what?
What is often injured when there's an ACL tear? What else is also injured? What'd you say? Not so much the PCL. There's like a triad. It's called the female athlete triad or something like that. the ACL, the medial meniscus, and the MCL. Often the three of those are blown out at the same time.
So ACL and
Anything else about the ACL that I'm missing? Do we get a good general overview? Okay, yeah.
And so is the torn meniscus. Well, like you can get the torn meniscus anytime, but
It's like from the trauma, the force,
Yeah.
the quick direction change, those kinds of things. Whereas your total knee replacement is maybe from doing sports for a really long time or just a lot of wear and tear on the knee. Can all of them be non-traumatic?
well, Arthur's traumatic.
What about a total knee replacement?
That
that
looks
be-
pretty traumatic to me. I don't know.
But the way that you don't necessarily get a knee replacement because you've been,
Sitting all
It
day,
just happens because of like.
so it's not traumatic because arthritis.
like if you're playing football, you get your knee taken out. Are you getting a total knee replacement? Is there more likely a meniscus tear or ACL tear, right? So it can, like if you were in a terrible car accident and it blew out your knee joint real bad, they might choose to do, like maybe there's a fracture at the lower end of your femur, they might choose to do a partial knee replacement or a total knee replacement because the damage is otherwise just, it's too much. But usually it's kind of a breakdown of the articular cartilage that's causing the need for knee replacement. Awesome. I think you guys did, we picked it up a little bit. I think you did well towards the end. I know it's hard to draw, but it makes it a little bit more fun. What?